Well, good afternoon, everyone. My name is Nidhi Shah.
And my name's Krishie Desai. Thank you guys for giving us the opportunity to present here today. We are both second year students at the AU-UGA Medical Partnership and at the Medical College of Georgia. And today we're going to be kind of presenting on a case about a patient who selflessly took on the role of being a caregiver, who kind of resulted in a subsequent delayed diagnosis of colon cancer. And this case really highlights a difficult situation that many people around us face, and including our own families, actually. And currently, our own parents are acting as family caretakers for their own parents. So sometimes this happens at the expense of their own health, which is why this case was so important for us to present.
For some broader context, as the US population is aging and medical interventions are increasing life expectancy, a lot of individuals are taking over responsibilities for caring for their elderly family members. They're expected to be trained, informed, and constantly available, often without any sort of support or preparation. Despite these significant psychological and physical strains, there's not much in place to ensure that they're up to date on their own health and receive the support that they need to meet their own healthcare needs while still tending to their elderly family members.
So specifically in our case that we're presenting today, we have a 57-year-old male who presented with a history of diverticulitis, colon polyps, and low testosterone. Our patient was undergoing his routine care and screenings until having to undertake the role as a caregiver for his elderly father-in-law. So in his role as a caregiver, our patient was unable to attend appointments with his primary care doctor he was seeing previously, or undergo any of his recommended screenings or laboratory tests, which included colonoscopies. Our patient also attributed many of his symptoms like intermittent rectal bleeding, fatigue, abdominal pain to his pre-existing conditions, which aligned with what he thought, and therefore he didn't seek out care at that time due to his caregiving responsibilities. Upon the passing of his father-in-law, our patient was luckily able to seek the medical care he needed, and his colon cancer diagnosis was actually found at a relatively early stage. Now, our patient is cancer-free without a colonoscopy bag, and this may not be the case for many other family caregivers who aren't as fortunate in their timeline. So, as Nidhi and I worked through this case, we found that there were many important takeaways that this case kind of demonstrated to us. Most of those kind of focus on the importance about accommodations for those acting in a caregiving role. So, and the ability for those caregivers to kind of get the medical care that they really need. Some ideas we kind of brainstormed included maybe early referrals to counseling services to evaluate the caregiving burden on individuals, respite care to provide caregivers with periods of relief in their duties, required screening questionnaires to find and evaluate urgent healthcare needs, and also expanded access to telehealth services, which would kind of mitigate the barrier that some caregivers face when having to come in person to their medical appointments.
The biggest issue that we saw is that caregivers are unable to make the time to go in when they're balancing their caregiving responsibilities as well as their own jobs and things like that. A lot of times, especially in our case, our caregiver had insurance and a primary care physician, but still was unable to go in to be seen. One big solution that we found to this is providing compensation to family caregivers, either in the form of time off from work or financially with the requirement of having a physical exam every year, staying up to date on all their screenings, and completing biannual mental health screenings. In conclusion, more efforts need to be made to ensure the health and well-being of family caregivers. Our case is a cautionary tale of how, without proper measures in place, family caregiving can quickly become life-threatening.
We just want to say thank you for listening to our case, and it's primarily kind of around advocacy for these caregivers. And we now are going to be open to kind of accepting some questions or any kind of thoughts people have on our case.
Thank you all so much. It looks like we do have one question in the chat from Susan Marie, and it says, how do you think this case could be used to develop a screening tool or protocol for caregiver health and well-being?
Yeah, so one thing we sort of looked into is there are a lot of efforts right now being made into making mental health screening questionnaires for caregivers, but there's not as much in terms of physical health. So maybe like a screening that has stuff like, have you gotten your annual screening for this, this, and this? When was the last time you've done that? And then also there was a couple of cases that we were looking at where the state allows the caregiver to be officially a caregiver for their family members, so they would get compensation from the state. And in those cases, it's not required to do some sort of preliminary physical exam or like a questionnaire for that. So developing a questionnaire that ensures that they have their own physical health in order in terms of medications that they need to take, if they're taking them regularly, any predisposing conditions and things like that would be really helpful.
We also kind of talked about the fact that there could be more information about this available to the public, especially because when you're in a doctor's appointment and if a caregiver has to bring in a family member, having some sort of informational document given or something plastered on the wall about the importance of getting your screenings done, especially for those in the caregiver role. Because once you see something that you specifically resonate with, so if I was a caregiver and I saw something that was directed towards caregivers, you kind of pay a little bit more attention to those.
All right. Thank y'all so much. Wonderful presentation.
Thank you so much.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.